As Albert Gheorghi says, research is seeing what everybody else has seen and thinking what nobody else has thought. Good day. I am Rexumar Perez, Teacher 2 at Victoria's National High School, Negros Occidental. I am currently studying at the University of Negros Occidental, Recoletos de Bacolod Graduate School, Bacolod City, Philippines. Thus, I am writing a phenomenological study, the health conditions and practices of public school teachers. Teachers' role in the teaching and learning process is very vital. For this reason, their health should be an utmost concern, not only by themselves, but also by the people surrounding them. Maintaining a certain level of health is not that easy. For teachers, they have a lot of things to attend to, starting from their bunch of paperworks, matters in personal life, and coping with the new normal education. Hence, their health should be the top priority. Teachers can only be effective if they maintain their health and energy levels, because if not, they will not be confident in meeting the needs of the students to the fullest extent possible. Consequently, their health or areas of health should be maintained or improved. The intent of this phenomenological study was to explore the health of public school teachers in Negros Occidental, Philippines. It sought to ask the following questions to guide the inquiry, such as, what is the meaning of health for public school teachers, and how does health is being experienced by public school teachers? The study utilized a qualitative research design using a phenomenological approach to gather more information on the health of teachers. It helped to describe an in-depth experiences of the phenomenon that focuses on the commonality of their experiences to arrive at the description of their health. They are a total of 6 public school teachers. They were determined using a purposive sampling technique according to the pre-selected criteria such as they are male or female, newly hired teaching personnel of 0 to 5 years in service, aging 20 to 35 years old, single in marital status, and doesn't have pre-existing medical condition. The data was collected using an in-depth interview. It was administered using a face-to-face interview, guided by the protocols set by the Department of Health. It started with the establishment of rapport with every participant to ensure that both of us are at ease in the process. It was followed by the pre-orientation on the purpose of the research, confidentiality of the participants, duration of the interview, its flow, and attending to the questions and clarifications of every participant before they signed the written consent conformity to proceed to the process. During the interview, they were asked to express their own experiences, which is comfortable for them. Thus, probing of answers follow. While they are expressing their experiences, I take note also of the non-verbal languages which help me in understanding the context of the participant. The interview ends with a debriefing and thanking them for the cooperation in the research process. The data were analyzed using the recursive textual data analysis guided by the 3 C's of Littman. The coding, categorizing, and conceptualizing was employed to analyze the data thematically. Informed consent was given to the participants. Coding was also employed to preserve their anonymity. The data gathered were safely kept until the results were obtained. Potential risk was also discussed. Informed consent was given and understood also by the participants. All the remaining data will undergo manual shredding. Soft copies of the data will be deleted after the analysis of it. Thus, Recycle bins will be cleared so that no traces of data will be obtained. Results show that the participants were certain on their current state of health. They were emphasizing their physical conditions that made them realize that they are healthy. Thus, physical manifestations of disease or infirmity are one of the bases for personal health assessment. All the participants verbalizes that their state of health is good so far. They don't feel any pain nor experience body weakness. They can sleep well. They have enough energy to do their daily tasks, especially in school. Also, the medical results were all negative. Thus, they have a lot of energy because of their careful food intake. Despite of claiming that the participants were consistently healthy, there were issues in health faced by the participants. But it was given a solution to overcome the dilemma. Hence, in battling health issues, we are an agent to alleviate our health status. Some of the participants shared that she is emotionally ill because she is still recovering from the death of her father. But when she feels sad or remember her father, she prays. Sometimes she makes herself busy doing household chores or indulging into planting. The other feels physically tired, but with amount of rest, she gets better. The other says her lifestyle is not healthy too. There are times that she would prefer to eat fast food because she is being lazy of cooking her own food. But she stressed that, as much as possible, she will cook now and eat more vegetables and fruits, which is a challenge for her nowadays. A personal assessment of their health was also called up from their experiences. Teachers exemplify their practices in monitoring their health. They demonstrate it by keeping an eye of their vital signs, their medical results, their food intake, and of course their sensing of their own self. Accordingly, they need to have a regular monitoring to ensure the status of their health. For example, some participants mentioned monitoring of their weight because it is an important marker, according to them, in helping to determine their current health. Also, the assessment of their height, their blood pressure, their cholesterol level, and their blood sugar. The other says the monitoring of their medical results based on the yearly medical checkup. The other is also monitoring their food intake. And the last one is assessing the health most of the time by feeling himself or herself or using his personal feelings. She could feel that there is something off with her. She tries to gauge herself if it could be risky for her to do the daily activities. When she knows that it could be risky, she rather take the rest or rather sweat it out. They have also basis for categorizing themselves as healthy. School teachers strongly emphasize that they are healthy because of their experiences that they confidently think that it is healthy. This enactment helps to maintain and improve their health status. Thus, being healthy notion differs from every individual. Because some participants shared that he can say that he is healthy because he eats when he's hungry and he feels satisfied of it. He can do the task given to him every day and he can embrace his functions and fall asleep too quickly. Also, physically, the teacher can do tasks without impediment and with lots of extra energy for other activities. Mentally, the teacher can carry himself in any situation that he may encounter. Socially, the teacher believes that he can do or he can adopt and cope up with his fellows. Lastly, the teacher thinks he's healthy because he never have been admitted to the hospital due to serious illness, or of course based on his medical results. They were all normal. Henceforth, there were recorded health practices to maintain their health. The participants' physical routine and practices in healthful behavior contributes to alleviate their health status. Doing it regularly or most of the days help in the maintenance of their health. Hence, health sustenance is achieved. Like the participants shared practices of eating healthy food, exercising regularly, drinking glasses of water, and getting enough sleep. For social, mental, and emotional health practices, the participants find ways to avoid social, mental, and emotional stress. Consequently, they make sure to divert their attention and use some medium to avoid stress. As such, allowing themselves to the reroute stressors to different helpful activities helps to avoid social, mental, and emotional stress or problems. For example, some participants mentioned of making sure of having me time. It is not isolating the self, but enabling to talk with the self. Some talks to their mother or other members of the family. Others are making themselves busy doing household chores or indulging into gardening. Lastly, the other says that days off are a time to clear their minds for everything that they have been thinking deeply, and it actually removes the stress they accumulate from work. And so, spiritual practices were also evident. By continuing their devotion and praying every time they encounter stress, it helps to lessen the tension or pressure. Identically, simple expression of faith reduces stress. Like some of the participants is continuing their devotion on a daily basis, and when they feel sad, they pray. In determining the state of health, individuals emphasize on the identification of their physical conditions. They only focus on things which they think are healthy for them. And so, individual assessment of health status differs. But with regular practice of healthful behaviors, areas of health will be maintained or improved. This research endeavor has taught me a lot of things. I should be efficient and prompt in passing all the necessary requirements. I have learned the details and rigor of a paper to be a candidate for future publication. This step-by-step process and the chance to be critiqued by distinguished panels has given me a professional confidence in which I can hold my head high when research is the topic. Thus, all the sacrifices are worth to be remembered and cherished as long as I am living. Therefore, research is what I will be doing when I don't know what I'm doing.